When Indiana Health Centers at Marion first opened its doors as a migrant health center in 1977, this little girl was the first patient cared for by doctors and nurses. Since then, thousands of patients, young and old, have received the same excellent health care, caring, committed, affordable, and accessible. For generations of families, this is their medical home. For 40 years, the mission of Indiana Health Center at Marion has stood the test of time to serve the health needs of anyone in Marion, Grant County, and the surrounding areas, especially the underinsured, uninsured, and needy.
So Christopher is a little bit high. It's 140/90.
Family practice physician Dr. Winifred O'Neill is the medical director. Currently, Indiana Health Center at Marion sees more than 7,000 clients a year.
Our patients initially, most of them who don't have insurance, enjoy coming here because we can provide medications, blood tests, everything to our patients. And funny enough, when they now do have private insurance, they don't want to go anywhere else.
Before I started seeing her, I stayed sickly a lot, and after that, now I should have got my diabetes regularly. Now I'm not bad off as I was. So I like the atmosphere.
We're going to do a height and weight today.
Board-certified physicians and staff see patients at hours the community selects. The clinic is open 3 nights a week and on Saturday and provides total family care for the whole community.
It's not everybody who gets the opportunity to enjoy their work and actually look forward to coming to work, and that's how it's been for me for the last 20-some years.
Family practitioner Jean Brown has been caring for 2 generations of patients.
I think we have probably one of the most diverse populations of people, college professors, family members of people who have chosen us, professionals in the community, all the way down to the person who is digging the ditches for some of the companies or trimming trees for a living. We care for all of those.
Clients receive services regardless of income, race, gender, religion, or country of origin. For the uninsured, payment is made on a sliding scale based on income. Phyllis Henderson is a longtime patient and now a clinic board member.
I don't think the people realize what they do here and how much.
IHC at Marion provides family health care for children and adults, walk-in appointments, physicals and immunizations, obstetric and gynecology, a mobile health van for migrant farm workers, chronic disease management, nutritionist, limited on-site lab, enrollment center for Hoosier Healthwise and Medicaid, drug assistance enrollment, and a WIC program. WIC, the Women, Infants, and Children Supplemental Feeding Program, serves more than 1,800 low-income clients each month. They provide nutrition and follow-up care to pregnant women, new mothers, and children up to age 5. Low iron levels in infants and either extreme or low weight gain are the most common medical issues Shalimar Hand and the other WIC staff see here.
And we see the babies 2 to 3 times a year, sometimes more, depending on their needs. We weigh them, get their height and weight, and check their iron. And then if we see a big nutritional problem, we'll refer them on to their doctor for follow-up.
He looks fine. His height or weight is in the 47th percentile. The next time he comes in, we will do a infant hemoglobin.
The young families get individualized care, supplies, and one-on-one instruction. WIC delivers results to young families with few resources and ensures a better standard of nutrition for infants.
Sometimes you can see the look on their face just as they come back in, and you have to enjoy what you do. And I do. I love seeing the kids, seeing them grow.
Indiana Health Centers at Marion is specifically designed to help the growing numbers of people who, for economic or other reasons, have difficulty accessing medical care. CEO Lynn Clothier says most of us don't understand who might be living in poverty around us.
Because of the high cost of living in America and because of the enormous cost of health care in America compared to any other nation in the world, you can make a living wage but not be able to cover the cost of your health care. If you're uninsured and you have some significant health event, the cost could lead to bankruptcy for your family and loss of your home.
Nationally in 2005, 1 in 5 Americans reported postponing seeking medical care. In Indiana, roughly 1 in 8 people don't have health insurance. More than 20,000 Grant County residents have incomes below 200% of poverty. And in Grant County, death from hypertension and kidney failure due to high blood pressure is nearly twice the state rate. But with increasing numbers of patients and patient chronic disease indicators staying under control, this clinic is helping to turn the tide.
Somebody above 50 with hypertension, this is a high cholesterol.
Okay.
So I think we need to work on that.
Okay.
Physician caseloads can be 40 patients a day. Dr. Novira Inam says they believe in a holistic approach to patient needs.
If somebody comes to us, it's not, we just take care of everything. If it's hypertensive, diabetic, we take care of that and talk about other issues. If there's something else going on, if you need some help psychologically, we help with that too. So yeah, it is kind of practicing complete medicine and taking care of the whole patient, not just concentrating on one thing at a time.
That includes managing chronic diseases such as diabetes, hypertension, and high cholesterol.
Currently have about 350 patients who are diabetic that come through our doors, and we work very closely with the providers as a team to make sure that every aspect of their chronic disease is managed and managed well.
Any pain in your back of your leg when I push up here on there?
A multidisciplinary chronic disease management team follows patients like Ricky Tucker, who has diabetes.
Blood pressure seems to be doing great, and your diabetes. You've actually lost, you lost like 10 pounds already since surgery. Good job, good job.
But Ricky is also an example of another IHC strength, pulling in a wide net of community resources to make sure patients receive the extra help they need, like her knee replacement surgery.
Our clients here, sometimes they don't even have bus fare. A lot of them ride the bus or they walk. With 3 or 4 children, it's 90 degrees out. They're exhausted by the time they get here. So a lot of financial need that we meet. We meet a lot where people aren't aware of resources. We've gotten very good at networking.
And a good community partner who's been a longtime supporter is Medicap pharmacy owner Urban Harvey.
We provide assistance as far as if they need certain medications, and what I try to do is, okay, what's this costing me? Can I come down quite a bit to where, I'm at least maybe recouping my cost.
Gary Smith is both a patient and the IHC Community Board Chair.
And the misconception is that healthcare perhaps is not as good, but I found out that the standards here are very high, and the healthcare is actually very good, if not equal, but better than, because they give a lot of personal attention to people.
It's passion, not a paycheck, that motivates at Indiana Health Centers. For 2 decades, Jean Brown has been part of IHC's medical outreach to migrant farm workers.
They perceive me as a person who helps them stay working, not a person who's going to put them off for a length of time so they don't have to work. So in the migrant programs, they're working with the Hispanics, the people who are working poor. I feel it's a privilege to be able to take care of them.
In 1996, this health check van, a 2-exam room mobile medical facility, began providing seasonal medical services. Most of the farm workers are American citizens. For their children and families, it's vital medical care.
Knowing the work that they do, they work 12 hours a day, 7 days a week. I don't think I've ever worked 12 hours a day, 7 days a week in any job I've ever had. And yet they are working those hours, and it's not easy work, repetitive, simple, that I take care of. It's hard to explain unless you're out there actually doing it, but that's what it means to be a health provider for people who are in need.
It's health care that is administered with a component that can't be prescribed, a mission for healing, and a passion for caring.